What about if people have been in dentures for many, many, many years, or they've been told by another dentist they don't have enough bone? You say you work with those people.
You know, and we see that every single week, Randy. There's so many patients that come in that say, you know what, I don't have enough bone, or I'm too old. They've always got something that they've self-diagnosed. What I'll tell you is that we have not turned a single patient away that couldn't get implants. We have not had a single patient that just couldn't receive implants. But, well, if they've been denture wearers for 30, 40, or 50 years, we're still able to provide implant therapy for those patients. And that's amazing. So when someone says, I don't have enough bone, well...
Does that happen? Is that rare, or you hear that like
we
frequently?
Hear that all the time. People say that all the time.
That another dentist in Vancouver told them you don't have enough bone for dental implants.
Well, another dentist anywhere. They get a lot of these misconceptions saying, well, you don't have enough bone. Well, that's maybe true, but we're able to graft things. We're able to provide so much with grafting and graft bone in width and in height, and give you back what you're missing. And a lot of times we don't even need to do that. We're able to do treatments like teeth in one day, where we can give you a full set of fixed teeth in one day without having to graft just to get the implants in. So there's so many more modalities that we're able to do just through technology and using the advances that we have in the office.
So is it their training then? And I'm sorry to get stuck on this, but is it the training of another dentist that they're limited in their training and they think that somebody can't get a dental implant because of not enough bone?
Sure, that's part of it.
You lecture on this.
Every week we have people that come in that say, you know, I was told that I don't have enough bone, and those same patients are walking around with fixed teeth that they got in one day. You know, whether it's someone who said they were too old or whatever other self-diagnosis or excuse that they have, a lot of times we're able to disparage that and give them fixed teeth
What
one
if
day.
You're on medication for osteoporosis?
Sure. So
you're still able to do this?
We treat osteoporotic patients that are on osteoporosis, diabetics. Once again, there hasn't been a patient that's come in that we haven't been able to treat yet in some way. You know, there's so many different treatment modalities, there's so many different ways to go about it, that there's so many options. People with medical compromise or medical histories that are very complex.
Do you talk to their medical doctors in certain instances?
Absolutely. For some cases, we're in direct contact with their medical doctors to work together as a team. It's a team approach. It's like in our office where we do everything under one roof. It's a team approach. We want to make sure that we're all collaborative, and it's not uncommon. It's not uncommon for myself to be in a consult doing something and have another doctor be called into the operatory and to get two opinions on that same case. That's quite amazing, to get two specialists to look at one case at one consult for someone when, you know, you get it collaborative. You get that collaborative feel, and that's quite an amazing experience.